1 in 8 women in the U.S. will be diagnosed with breast cancer in her lifetime. Tragically, 1 in 39 will die from that diagnosis. I spoke with breast radiologist Dr. Ruby Marodi from St. Luke's Cancer Institute to find out how the latest early detection tool can help women be more proactive about their breast health. So let's talk about Fast Breast MRI and how it benefits the patient.
Well, thank you so much for having me today. We are thrilled at St. Luke's to offer one of the latest tools in breast cancer screening, which is the Fast Breast MRI, also called abbreviated breast MRI. We take only the essential sequences from the traditional MRI so that the exam is less than half the time. And not only is it shorter and therefore less costly, but studies show that the Fast Breast MRI can detect more breast cancers than mammography screening alone.
And if data tells us that 1 in 8 women will be diagnosed with breast cancer in their lifetime, I mean, that's one person at a dinner table. Who should be getting the Fast Breast MRI?
The Fast Breast MRI is geared towards women at average risk and those with dense breast tissue. So women at high risk should continue getting the traditional breast MRIs. A woman needs a negative mammogram within the last 12 months and an order from a physician. A woman knows that she has dense tissue based on that prior mammogram report. Now, dense tissue is normal, and about half the population has that dense tissue that can hide cancers on mammograms. Breast MRI is not affected by breast tissue density and can therefore detect more cancers. Now, some of the downsides to Fast Breast MRI is that it's not currently covered by most insurance companies, so there is a $400 out-of-pocket fee. Contrast is administered through the vein, so an IV is required. And then some women will need additional tests after the Fast Breast MRI, such as an ultrasound and or biopsy.
You outlined a little bit of this already, but should women get fast MRIs instead of mammograms?
So mammography is still the only imaging exam proven to help decrease breast cancer deaths. So women should continue getting yearly screening mammograms and consider the Fast Breast MRI as a supplemental study. So each exam has its strengths and weaknesses. So getting both gives women the best chance at early breast cancer detection that can lead to treatment success. As you mentioned already, 1 in 8 women get diagnosed with breast cancer in her lifetime, and unfortunately 1 in 39 will die from that diagnosis. So women, go be proactive about your breast health and talk to your doctor to see if the Fast Breast MRI is the right supplemental screening for you. This fast exam could save your life.
Early detection certainly is key. St. Luke's Cancer Institute has 8 locations where you can schedule a Fast Breast MRI. Just go to stlukeskc.org to find the imaging center closest to you, and you can schedule that appointment.